Hey there, I'm Jennifer Scalici. I'm a GYN Oncologist at the Mitchell Cancer Institute. And as it is January, I wanted to talk a bit about cervical cancer awareness. We recently have heard from President Obama a call, a moonshot, if you will, because we have a lot of work to do in cancer research. There's a lot of diseases that need a lot more research. In cervical cancer, we have in effect nearly answered that call, and that is because we have a vaccine that, for the most part, prevents most cervical cancer. Most cervical cancer that we see and treat here at the Mitchell Cancer Institute is related to the HPV virus, and there is an HPV vaccine, and that was built in 2006 and rolled out at the time only to girls between the ages of 9 and 26, but we've gotten better. We realize that in order to truly make an impact, we have to vaccinate girls and boys. And the vaccine has gotten better. It covers more of the strains of the HPV virus. Most recently, it covers 9 strains, the most recent vaccine that was approved in November of last year. This vaccine has the potential to significantly reduce the number of cases of cervical cancer we see each year, which is 4,000. Cervical cancer is also the, I believe, second leading cause of death worldwide among women. And in the United States, again, we see about 4,000 cases a year. In the United States, we have an uptake problem. We have a vaccine that cures cancer. We have a vaccine that prevents cancer, but nobody uses it. There's a lot of propaganda, a lot of fear surrounding a vaccine because it's something that you have to give to a child, and that's a scary thing to do. But websites such as the CDC.gov, specifically looking at the HPV vaccine, shows the data that this is a very safe vaccine, probably safer than any other vaccine that we give our kids from infancy on up. And the benefit is not only does it prevent cervical cancer, it prevents all of the pre-cancer problems that come along with it. Now, those are issues that are curable, those are issues that are treatable, but the treatment can be just as devastating as the cancer itself. When a young woman has to make a decision about treatment of pre-cancer changes that impact fertility and reproductive health, the costs associated with that and the long-term impact of that is significant. It may not be cancer, but it significantly impacts a young woman's life. The other issue is HPV does not discriminate between male or female. It affects us all. There are about 14 million cases of contracted HPV a year. Now, 90% of the time, you get rid of that. Your body gets rid of that just the way it does any other virus. But for the 10% of those that hang around, they can cause some significant problems. HPV-related cancers don't only include the cervix, includes the vulva, the vagina, but also head and neck cancers. About 50% of head and neck cancers are also related to the HPV virus. So the reach of this vaccine is much broader than simply preventing a disease where we only see 4,000 cases a year in the United States and we have ample screening for it. Not only does it reduce that, it reduces the large number of procedures that we have to do to prevent that cancer. It reduces the incidence of head and neck cancers, which are becoming more prevalent in the population, likely because of the HPV in the population. So HPV vaccine answers the moonshot, in my opinion. It prevents cancer, actually takes it a step further. It prevents cancer before it ever starts. And if we're looking for something, to impact the state of affairs in terms of cancer in the United States, this is it. There are a lot of questions surrounding the vaccine, and I would direct anyone interested to the CDC website, cdc.gov. Specifically, search the HPV vaccine. It will tell you more than you need to know. But my recommendation is that all children between the ages of 9 and 11, both male and female, receive the vaccine. The newest form of the vaccine on the market is the 9-valent vaccine. It's a series of 3 shots. I believe they are a month apart, but again, I refer you to the website for the details, as well as details in terms of who can get it, even if they're not the appropriate ages. There are catch-up schedules, and all the other questions are answered there.
Good.